Human metapneumovirus, HMPV, is a respiratory pathogen that has recently garnered significant attention due to a surge in cases in China. This video delves into the nature of HMPV, its symptoms, transmissions, and the measures China is implementing to manage the outbreak. HMPV, the virus that could restart the pandemic. Understanding HMPV. HMPV is a virus that primarily affects the respiratory tract, leading to infections that range from mild cold-like symptoms to more severe respiratory issues. It was first identified in 2001 and has since been recognized as a common cause of respiratory infections worldwide. Symptoms of HMPV. The clinical presentation of HMPV can vary, but common symptoms include cough, fever, runny or blocked nose, headache, fatigue, etc. In certain cases, especially among young children, older adults, and individuals with weakened immune systems, HMPV can lead to more severe conditions such as bronchiolitis or pneumonia. Transmission of HMPV. HMPV spreads through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus and then touching the face. The virus is known to circulate more frequently during the winter and early months in spring. Recent outbreak in China. In late 2024, China experienced a notable increase in HMPV cases, particularly among children under age of 14 or under the age of 14 in the northern provinces. This surge led to concerns about the potential health crisis reminiscent of the COVID-19 pandemic. However, health authorities have emphasized that while the number of cases has risen, the overall severity and spread are less significant compared to previous years. China's response to the outbreak. In response to the uptick in HMPV cases, Chinese health authorities have implemented several measures. Enhanced monitoring. The National Disease Control and Prevention Administration has initiated a pilot program to monitor pneumonia cases of unknown origin. This system aims to establish protocols for identifying and managing unknown pathogens, enhancing the country's preparedness for future outbreaks. Public communication. Officials have addressed public concerns by providing accurate information about HMPV. Foreign Ministry spokesperson Mao Ning stated that respiratory infections tend to peak during winters and reassured that the government is attentive to the health of both citizens and foreigners in China. Preventative measures. Citizens are advised to practice good hygiene, such as regular hand washing, wearing masks in crowded places, and staying home when experiencing symptoms to prevent the spread of the virus. Comparison with COVID-19. While the rise in HMPV cases has caused concern, it's important to note that HMPV is not a new virus and does not pose the same pandemic threat as COVID-19. There are no specific vaccines or antiviral treatments for HMPV. Management focuses on alleviating symptoms through rest, hydration, and over-the-counter medications for pain and fever. Global perspective. The World Health Organization, WHO, has not indicated that the current HMPV outbreak in China constitutes a global health emergency. Seasonal surges in respiratory viruses like HMPV are common, and the situation is being monitored closely by international health bodies. In conclusion, HMPV is a respiratory virus that typically causes mild symptoms, but can lead to severe illness in vulnerable populations. The recent increase in cases in China has prompted health authorities to enhance monitoring and public communication to manage the outbreak effectively. While concerns have been raised, current evidence suggest that the situation is under control and standard preventative measures remain effective in reducing the spread of the virus. HMPV, the virus that could restart the pandemic. Please be sure to like, comment, subscribe. This has been a word from William. Thanks for watching and enjoy.